One of the deadliest diseases on Earth may finally be coming to an end thanks to research by this year's Nobel Prize winners. Malaria is thought to be responsible for killing half of all humans who have ever lived. And yet around the world, rates of infection have been steadily dropping. So we wanted to know, is this the end of malaria? Well, malaria is a parasitically transmitted illness. It relies on disease-carrying parasites, which are transmitted by one type of female mosquito called Anopheles. That's Greek for useless. But despite their name, these insects kill about 600,000 people a year, or about the entire death toll of the American Civil War. While this number seems massive, it is actually incredibly good news. According to the World Health Organization, between 2000 and 2015, new cases of malaria were cut by nearly 40% thanks to better prevention methods and resources. Overall, deaths from malaria fell by nearly 2/3, with even lower rates among young children. This is incredible, considering that the primary methods of eliminating the disease are focused on simply blocking mosquitoes. Nets treated with insecticide, along with anti-mosquito sprays, have been used with such effectiveness that since 2007, 4 countries have been certified as completely eliminating the disease: the United Arab Emirates, Morocco, Turkmenistan, and Armenia. Just this past year, 13 countries reported they were malaria-free, and 6 more reported less than 10 cases. At the same time, impoverished sub-Saharan Africa has been struggling. Worldwide, 9 out of 10 cases of malaria and deaths from malaria are in the sub-Saharan region. One of the biggest reasons for this is that the most effective defense is the ability to monitor the spread of the disease. But governments and health services of hard-hit countries are often inadequately able to access and analyze disease trends. This effort to fight malaria has been publicly spearheaded by philanthropists Bill and Melinda Gates. In Zambia, the Gates Foundation contributed roughly 3 million mosquito nets, raising the number of households with a net from about 1 in 5 to 4 in 5. Even something as simple as a net works to dramatically lower infection rates. The more prevention there is, the fewer people need to be treated, and thus fewer people are further infectious. This not only frees up medical resources, but also creates a downward spiral in disease rates. Thanks to the World Health Organization, the UN, the Gates Foundation, and other NGOs, some 55 countries in total are on track to cutting their case rates by 75%. By 2030, the WHO hopes to cut infections and deaths from malaria by 90%, and to raise the number of completely disease-free countries to 35. This year, the world saw the lowest rate of malaria deaths in history. As more money, resources, and manpower is devoted, people like Bill Gates have predicted that we may just see an end to malaria within a single generation.